So if you're newly diagnosed with Crohn's, it can obviously be quite a shock. And, a lot of people talk through the physical part of it and the treatments, but what the mental state? It's a shock to the mental state as well. So what can you do, or what advice would you have for people who are newly diagnosed to, thrive or adjust while living with the new diagnosis of Crohn's?
That's a fantastic question in the sense that, I think I was very fortunate because even though as a minority community, my community does not really believe in getting yourself mental help. It's another taboo subject. It was something my mother believed in. And when I first got really sick at the age of 24, she's like, Tina, we're finding you a therapist. She put me into therapy. She insisted on taking me to support groups, whether they were, in the hospital related to IBD or related to ostomy surgery, whatever it was. That was the driving force for me to get mental health care. And I can't even thank her enough today because mental health is, how do I even emphasize this? The physical journey is half of this. The mental health journey is the other half. And that's what people don't realize is as you're struggling to make it to the bathroom those 40 times a day or whatever you might be facing, your mind is also like, oh my God, what did I do to deserve this? Oh my God, like how did I even get to this place? I'm 22 years old. I should not be like going from college onto Wall Street and then out and seeing, potentially the days of your death closing in on you. Like I've been I've had near-death experiences 4 times with this disease. It's completely unacceptable at a young age to not have mental health care alongside this disease. And I think the push towards GI specialties, especially some of these academic centers having GI psychologists in their office and coordinating care between the GI and the psychologist is one of the best things that I think has happened to this field in the last several years. I understand it's not easy for most academic centers or even community centers to be able to pull this off, but it is absolutely necessary. There is just no way you don't have a mental health journey with this disease.
Yeah, that makes sense. It's amazing how closely, interrelated they are. And then talking about the kind of the future, we're working on developing patient-centered therapies here at SmartTab. And then what do you see as some of the unmet needs for patients today with IBD, Crohn's, and their experiences with the treatments today?
So I was alluding to this a bit earlier. I think we need definitely more endpoints as far as treatment goes. But aside from that, I think unmet needs, one of the biggest ones is outside of this pandemic, of course, as young people, we want to see our friends. We want to go out to dinners. We want to go out to bars. We want to have thriving careers and get through undergraduate degrees or graduate programs. We have lives to live. We have dreams that we would like to fulfill, that this disease like pulls the rug out from underneath our feet. Not having that day-to-day sort of a balance in our health or not having that sort of certainty around our disease really takes a lot of quality of life away from us. What I would like to see more of is in the future, obviously, something more related to precision or personalized medicine, yes, but how do we get there? I really would like to see some kind of wearable technology that's not super cumbersome that helps you understand when you're going to flare up or when you're heading in that direction. Something that's looking at the chemicals in your body and is like, oh, this, that, or the other is spiking. Some of these inflammatory markers might be spiking right now. With that, even if it's a pinprick that patients with diabetes have, something that can tell us that, look, we are on the verge of potentially flaring up, and that tomorrow, maybe the next week, we might not have a guarantee on the next week or two, but at least we will know that something's coming our way so that we can sort of mentally prepare for it and also, pull out of plans or, ask for accommodations at school or work in a way that isn't sudden or jarring to our employers or to our school staff. I would like to see something that gives us a little bit more certainty with our disease.